nutritional deficiencies to develop when there is when these symptoms are present, right? They're not able to stomach food. They're not able to eat as much. So reduced calorie intake means reduced nutrient intake, both macronutrients, that's fat, carbohydrate, and protein, but also the vitamins, the micronutrients, minerals, okay? So one of my big concerns that hit me right away when I heard about these GLP-1 agonist medications was the fact that if they cause diarrhea, we're going to see a lot of mineral deficiencies, magnesium, potassium, sodium being drained from the body, right? Because that is lost through the evacuation of stool, the watery evacuation of stool, because these nutrients are water soluble. Right? The body can't hold on to them very long. They get washed out if they're not used in a lot of cases. All right. And so here I'd like to begin, before we go into the supplementary nutrients, just some basic dietary recommendations. So number one is staying hydrated. When you're not able to keep food down, you're not able to keep food in, then you're going to be losing a lot of water. So number one, staying hydrated with water. I like to recommend salting water, and it doesn't have to taste like the ocean. I'm talking just about a little pinch of salt, and that is going to be usually enough to replace some of the sodium now that is lost through the nausea, the vomiting, and the diarrhea. So we can do that, and can be surprisingly effective and quite quickly when nausea is present. Often the nausea is due to a drop in blood pressure, due to the sodium loss, after all, okay? We can also use ginger or peppermint teas. Ginger is widely known, traditionally used for pregnant women who have, nausea of pregnancy, and seems to settle the stomach. There's quite a lot of good evidence of this, and of course a long history of traditional use, like I said. So ginger tea, peppermint tea. Just one reminder, a lot of people who are not accustomed to drinking herbal teas don't realize they should actually steep the tea much longer than if they were going to steep green tea or black tea. So instead of 3 or 4 minutes per bag, it should be steeped much longer for full benefits from that botanical, that herbal, okay? So ideally, they're going to be steeping it for, 8 to 10 minutes to receive maximum benefit, okay? Another tip is obviously to eat less, smaller meals, and that's usually not difficult to do because the individual will be nauseous. But the key thing here is getting enough protein, because that's one of the nutrients that fills the stomach faster. And here I'd like to suggest the inclusion of a protein supplement, for example. Again, we don't sell any at Pure Lab Vitamins, but there are plenty of other options, which I know Molly and Shirley have worked on choosing for your customers to have in the store. And one of my favorites would be a whey protein isolate, just generally speaking, because whey protein isolate does not contain any casein or any lactose. So something to keep in mind for your customers who have issues with lactose or think they're allergic to dairy or intolerant to dairy. The whey protein is a different component of the milk that is usually really well tolerated, okay? Very easy to absorb, it's pre-digested, and really simple that way, okay? So something like a New Zealand whey. So that's always a great idea because it's not very filling, and so a person can put that in water and drink it and not feel full. Now, with real food, meaning food that resembles food, that's breakfast. I find breakfast is probably the toughest meal for most people in my practice, regardless of the reason they're seeing me. Understanding they may not have the time or the stomach for boiling eggs, they may not realize there are quicker options and easy options available. So I mentioned the whey protein isolate powder added to a cereal, or yogurt. These things are usually digested more rapidly because they're less complex than fats and proteins, solid fats and proteins. With some berries, for some vitamin C, for example, Then we have the muffin cup egg vegetable tart idea. This is like a little mini frittata you would make in your muffin tins very quickly, 15 minutes in the oven, and you have a whole dozen ready for the next couple of days. Those can be eaten one at a time, several times a day to get a bit more protein, right? Cottage cheese and berries is another idea for protein. Notice I'm combining proteins with carbohydrates here because, again, carbohydrates are what give us energy. They're the favored energy of for the brain and the muscles, right? So if you ate protein and expected to feel energetic, that usually doesn't happen unless it's the only macronutrient present in the diet. So the protein is here more for preserving muscle, as Molly suggested, making sure that muscle loss is not part of the weight loss. It's nice to see weight loss on the scale, but wouldn't you rather see fat loss? Because that's what we need to protect and reduce protect health and reduce health risks among this population, right? Protein shake again, blended with berries. Again, I am using this idea of recycling it a little bit because just showing you how many variations there can be for someone who says, oh, I don't think I can do the powder and the yogurt and the berries, or the cereal, the protein and the berries all together. If it's too much, then they can shrink it down to something a little simpler. But to me, the protein should always be included along with some carbs. And usually there's some fats there coming in from one of those items. Again, the eggs or the cheese will have that present already. So they're getting all three macronutrients ultimately. So those are just a few meal ideas. Again, I chose to focus on breakfast here to help you just because that's the meal a lot of people will skip or say they don't have time to make properly. And then they wonder why they're tired later in the day because they haven't eaten enough calories. So that's something I see over and over again with clients, female and male. Overall, I see more females in my practice, but I think they're equally challenged by getting enough calories in the morning to prevent overeating later in the day. In this case, with the medications we're talking about, the chance of overeating is probably quite severely curtailed. All right. Right. Fiber intake not only gives some bulk to the stool, for people who have loose stool, but also the fruits and vegetables are great sources of vitamins and minerals. And we have nuts and beans. These are all whole foods. As a whole foods holistic nutritionist, I believe that should be the foundation of health of the diet because that's the nutrients that actually are required by the body. Now, having said that, food is not as nutrient dense as it used to be, even if you're choosing these whole foods. I'll talk about that a bit more later. But taking in these fibers and fiber sources brings in antioxidants, water, and fiber all together. Okay. There's the pinch of salt idea. I was so excited about that one. I've seen such great results with it that like very rapid results. I cannot overemphasize that with clients saying, their nausea or lack of appetite actually came back once they added the salt to their water and within minutes in some cases. So it's very exciting. If it's that simple, right? It might be more complicated here with the GLP-1 users, but why not give it a try, right? All right. And so because of some of the dietary limitations, the caloric restrictions that will ultimately happen with these individuals due to lack of appetite, we need to increase their micronutrient intake with supplementary vitamins and minerals. They're really, I think they're taking a big risk if they're not doing that. This could lead to a lot of problems that are related to nutritional deficiencies. Now, in North America, in modern times, 21st century, we think we're immune to nutritional deficiency, don't we? And it's simply not true. There are cases of many very unexpected, but actually increasingly common cases of vitamin C deficiency or scurvy, vitamin B12 deficiency for other reasons that relate more to immune dysfunction, but also mineral deficiencies because the minerals are just not in the food anymore in the quantities they once were due to intensive farming practices. Okay. So we're going to begin with, well, next, the top nutrients for the GLP-1 user population. I think these are the nutrients that require attention. I want you to know there isn't much research yet on micronutrient deficiencies in this population. And so we are making some assumptions here based on the logic of lack of intake, lack of appetite, the symptoms and the complications that they cause, like the water loss, dehydration, and electrolyte deficiencies. I'm going to explain each one as we go through them. And let's start again about with some basics about each nutrient you see here. All right, so I've decided to start in reverse order. We're going to talk about vitamin C first. Now, this is a nutrient that the human body cannot manufacture. There are very few animals that cannot manufacture their own, and we are one of them. All right. So that's important because it means we absolutely must get it from our, dietary intake, supplemental. We can't make it ourselves. Why is it so important? Well, this is a nutrient, although it's known for immune benefits, it actually has more to do with collagen production. So collagen is that basic protein that, and there's many types in the human body, the basic protein that tissues are made of. And muscle tissue, hair, skin, nails, all right, almost all body parts are made of collagen of some sort. And vitamin C is really critical for its production, okay? So when you don't get enough vitamin C, your collagen starts to break down and you can't make more of it. So if you've heard of the disease scurvy, it manifests as fatigue, which is a very general symptom, but then it continues on to microbleeds, little microhemorrhages that can occur in the gums or under the skin, and dental issues, more cavities, more infections in the mouth, gingivitis, think periodontal disease, joint pain, poor wound healing, and anemia, again, because all of these tissues depend on adequate vitamin C, even the bones and teeth. Now, anemia, because, well, for two reasons. Number one, this is a nutrient that, because it's a weak acid, ascorbic acid is its name. Forgot to write that here, is really critical for absorption of iron, and iron being critical for red blood cell, capacity to carry oxygen. So without it, we may not absorb our iron as efficiently, but it's involved in so many things. I would have to spend a whole hour just about vitamin C, but I wanted to point out some of just some of those key, functions. And I'm not talking about benefits. I'm talking about functions, as in need to have. Otherwise, scurvy can develop. How quickly? Well, recent evidence is that showing that just in a few weeks, an individual can develop these symptoms of deficiency from vitamin C if they're not getting it in their diet. So what makes a GLP-1 user more vulnerable to vitamin C deficiency? Well, if they're on a low carbohydrate diet, then they are not getting like fruits. They're not getting, higher calorie sources of carbohydrate that actually are your major vitamin C sources. Yes, there are vitamin C sources in the vegetable kingdom, broccoli, red peppers, but keep in mind that if those foods are cooked, you lose the vitamin C. This is not a very heat stable nutrient, so it's lost through cooking. That's why raw foods are essential here. So again, that may or may not be appealing to someone whose appetite is affected by their medication, and for other reasons as well. As I said, lack of fruit intake could lead to deficiency. So it can be very hard to get enough of in the diet to support collagen maintenance, muscle maintenance, as well as maintenance and growth if they're doing any kind of exercise program as well. It's a cofactor in the production of collagen. All right, so the solutions are to eat more more raw vegetables, red or green, depending on what they are here, as I've listed. and to supplement vitamin C. To me, this is the obvious answer. Vitamin C is one of the most popular supplements. You may notice in the pharmacy, people buying that preventatively, thinking, it's really good for the immune system, and it is indirectly. But again, one of the reasons is that it's so important for tissue integrity and maintaining and healing wounds as well. Okay. So I think that's an important one. Now, Pure Lab has a line of vitamin C options, and what's special about our vitamin C is that it is corn-free. That means that corn was not involved in any step of the manufacturing process. Instead, we use tapioca in the manufacturing process for our vitamin C. Okay, and since tapioca is typically hypoallergenic, people don't react to it. It's not genetically modified yet. It's a good option for vitamin C. And so we have three options here: the regular 1,000 milligram capsules. We have also a slow release version, which allows for the blood levels to remain up to twice as long as any standard vitamin C that is not slow release. So I think that offers a really good opportunity to take fewer capsules less often, because this means the individual will have that vitamin C lasting in their bloodstream for twice as long as any other type of vitamin C, thanks to its clever compounding. We can explain that a bit later if you want to know more about that. But for those who don't want excipients being additives, things like flow agents, emulsifiers, anti-caking agents, things like that may be added. Even flavors and colors are considered excipients. For those who want something pure, we have our pure vitamin C powder. So there is nothing in that jar other than 100% ascorbic acid, vitamin C. Okay, so that is the choice product for those who want just pure vitamin C, nothing else. So that's also our best value, as you'll notice. You'll see 500 scoops in one container, and one scoop will have 500 milligrams. Okay. So individuals can take this once or twice a day to help maintain their vitamin C levels. And again, remember, it's a water-soluble nutrient that gets washed out. Whatever doesn't get absorbed, the body can't store it for any length of time. And so we need to replenish it often. Okay. Replenish it less often with the slow-release product, like our slow-release vitamin C. Another nutrient I feel is highly should be watched, highly vulnerable to deficiency would be vitamin D. Now, I think a lot of people know they should be taking vitamin D. What they may not know is if they are overweight, obese, morbidly obese, they're actually going to need more than the average person. They'll need more of every micronutrient because they have more tissue, more mass, more blood volume. They have higher nutritional needs just by being overweight. Okay. So vitamin D, very commonly deficient, especially at this time of year in Canadians, if they are not supplementing. And so let me tell you a little bit about why it's so important. First of all, the body can make it, vitamin D, using a chemical reaction that involves UV light, sunlight, and cholesterol in the skin. That is how we manufacture vitamin D. It's a fat-soluble nutrient, so it doesn't become deficient as quickly as water-soluble nutrients like vitamin C. So that's a good thing, but nevertheless, those who don't take it typically run into deficiency within a couple of months, because if they're not getting exposure to direct sunlight, they're wearing sunscreen, they have darker skin, they are going to have very much lower production of vitamin D because their skin works so well as a sunscreen against that UV needed to make the D. But vitamin D is really important for calcium absorption, the uptake of calcium from the digestive tract into the blood. Okay. So for that reason, it can affect bone density, bone formation, and maintenance. All right. It's very important to inflammation regulation as well. Modulating inflammation seems to be helpful for people with overreactive immune systems, helping modulate that excess inflammation. So in autoimmunity, rheumatoid arthritis, for example. But it's also important in ensuring adequate immunity against pathogens, viruses, and bacteria. Mm-hmm. And more recent research has showed that glucose metabolism functions best with adequate vitamin D. And what happens if you don't get enough? Well, the symptoms can be quite vague and often are completely overlooked. Things like muscle pain, right? It's great to take magnesium, but what if the pain you're experiencing is due to vitamin D deficiency? Dental abnormalities, again, changes in the enamel and also in cavities, cavity formation, increased cavity formation, bone pain potentially, and increased risk of bone fracture longer term. Okay. And so, again, a little bit vague, but we could add to that a lot of other things like immune weakness, more vulnerability to colds and flus and other infections. Some research has shown that people who have adequate vitamin D recover faster from some of these upper respiratory infections that are common these days. And so vitamin D is challenging to get through diet because, first of all, if you're vegetarian or vegan, it's important to realize there are no vegan sources in the diet. Okay, so unless you have a greenhouse in which you're growing mushrooms with the help of UV light, that's a type of cultivation or cultivated mushroom. You're not going to get any vitamin D from plants. Uh, Fungi, yes, but plants, no, because there just are no natural sources. They don't have the ability to manufacture this vitamin. So you have to get it from animal products. And some of the other issues, I've mentioned obesity increases the requirements. Also, statin drugs might reduce the synthesis of vitamin D since it is cholesterol dependent. Yes. If your client has had their gallbladder removed, then this can impair absorption of fat-soluble vitamins, and vitamin D is one of those nutrients. People with reduced calorie diets may have lower vitamin D production in general. Again, might be relating to some of these other factors, cofactors I've mentioned already, and I talked about sunscreens as well. Dietary sources are very low and limited. Vitamin D is fortified. Milk in Canada is fortified with vitamin D, as is a lot of the plant milk sort of substitutes. Other than that, though, unless you're eating organ meats, it's very hard to get from the diet in sufficient quantities, even to meet the very basic recommended daily allowance, which you'll see a couple of my slides indicate RDA as a recommended daily allowance. That's the minimum amount to prevent deficiency symptoms from occurring. It is not the optimal amount. I view it as an outdated amount. We need to go a little higher than that. And I think Health Canada is realizing that too with their licensing of amounts like 1,000 units of vitamin D, and higher even to 2,500 units. PureLab has a line of vitamin D3 supplements that are special because they are dry form vitamin D3. So what is dry form? It means that there is no oil in the capsule. You're going to see a powder inside the capsule. And why we do that is because vitamin D is very delicate. It's fragile. It spoils easily when exposed to air, light, heat, depending. Again, some of those are more of an issue than others. And if you were to take an oil-filled capsule, that vitamin D inside that capsule does not have the shelf life that the dry form powder has. It degrades much faster. Not to mention the oil that it's impregnated in can go rancid over time. So every time you open the bottle, you're introducing oxygen into it. The same problem with liquid vitamin D3. That's why we don't do that. We use a dry form to provide extended span of potency over time, so that this, by the time you're finished the bottle, you're hopefully still going to be getting that 1,000 units per capsule compared to some of the other brands out there. Okay. So ours is sourced from New Zealand wool wax. Our regular is sourced from that. We also have 2 vegan products, our 1,000 and 2,500 units for those customers who are vegan. And I've indicated the sources here being lichen or pine, soon to be pine source across the board when it comes to our vegan vitamin D3. So that is where we get our vitamin D. That is how it is. It's synthesized using those materials. Okay. Then we arrive at magnesium. Magnesium is probably one of the most efficient minerals in the diet in North America. Worldwide, iron is still the winner, but here's a water-soluble mineral that has a lot of major functions that affect muscle and nerve, as well as bone and maintenance and formation as well. And blood glucose control. Diabetics typically need more magnesium in order to support a healthy blood sugar balance. Protein synthesis depends on adequate magnesium. Again, thinking about muscle maintenance to prevent loss of muscle in people on reduced calorie diets. It's involved in energy production. And in fact, it's a cofactor in over 300 different enzyme systems in the body. So it's utilized by almost every cell and at any given time for a number of important functions. So again, very important, essential nutrient. And deficiency signs and symptoms range from muscle cramping and twitching to loss of appetite, nausea, numbness, fatigue, and weakness. So some of those things should ring some bells, and you wonder now that if perhaps, is it possible, you think, that some of the side effects of some of these medications may have to do with the nutritional deficiencies that they are inducing? Not completely, but they may be playing a role in their symptoms, right? So perhaps it makes sense to make sure the individual is able to maintain some degree of magnesium intake so that they don't have such severe symptoms. Okay, so that's my hypothesis. Now, I said here RDA, recommended daily allowance, 350 to 450 milligrams. I put an asterisk here because it'll always depend, again, on the size of the person, the activity level of the person. This is the range that you want to start with and go up from here. Okay. It's difficult to get enough magnesium in the diet. I wish I could tell you that it was easy, but it's not. Unless you're a squirrel and you love to eat nuts and seeds, it's very difficult to get enough magnesium through food alone. The nuts and seeds are the top sources, but they're common allergens. So this is something to consider for some of your customers who may have allergies. They may not be able to consume those foods, and therefore their magnesium could be lacking. Foods that are processed, ultra-processed foods are everywhere now, ubiquitous and very popular. They're time-saving, but unfortunately very low in nutrients. So they reduce a magnesium content of food, the over-processing, together with the over-farming of the soils. Now that the food doesn't have very much magnesium in it to begin with. So how do we resolve this? Well, as long as they're not allergic to nuts, they could load up on nuts and seeds. But I find those personally very filling and high caloric. So they may actually not be very good choice for people on these medications. Nut butters might be, have higher compliance. Almond butter, for example. But again, depending on the individual, it may not be appropriate. So to me, supplementation is still the surefire way to get adequate magnesium in the diet every day, since it may be a nutrient that is deficient. Okay. So our magnesium is a magnesium glycinate. It was our first product. We've had the same formulation since 2002. Why? Because it works. And what does it mean when I say it works? I'm talking about the fact that it is so well tolerated and it is so effective in helping people with various symptoms related to muscle function. So I can list a whole number of things. Again, the cramps and the spasms and the constipation and gosh, pain, all kinds of things. Again, when magnesium is deficient, those symptoms are sometimes the warning sign. Okay. So our magnesium glycinate is different because it contains less magnesium oxide in the formulation. So magnesium glycinate isn't usually just pure magnesium and glycine. It's usually mixed with magnesium oxide to give you a higher elemental value, i.e. higher amount of actual magnesium per dose. So we have done that, added a bit of magnesium oxide, but not very much. It's less than 30% of our formulation. The other 70% is true magnesium, chelated magnesium glycinate. And so we wanted to enable better bowel tolerance with our magnesium, i.e. it won't have such a laxative effect, unlike magnesium citrate or some of the other magnesium glycinates on the marketplace, which use more magnesium oxide in order to bump up their elemental value per capsule. All right. So that's why ours is only 165 milligrams. It's a very well absorbed 165 milligrams. And if your client has difficulty swallowing, we offer this in a powder as well. They can alternatively open the capsules and dump the powder into a beverage or shake. Okay. So lots of options there, but I wanted to introduce to you our flavored magnesium glycinate product for those who want something a little more exciting than just pure powder, unsweetened. We have sweetened this with a very minimal amount of organic cane sugar, 1.3 grams per serving, which in comparison to a glass of orange juice, which has 20 grams of naturally existing sugar, we feel this is really completely inconsequential, 1.3 grams. We did it just to give it a little bit of sweetness. It's naturally colored with beet powder, naturally flavored, and each scoop has 200 milligrams of elemental magnesium per serving. Again, using our original magnesium glycinate formulation. So 60 servings per container. This can be added to room temperature water. It can be added to cold water. No hot water is required to utilize this and benefit from it. It dissolves really nicely. And it's a very delicate flavor, so it's not going to be very potent. Sometimes strong scents and strong odors and flavors can be problematic for people with nausea, right? So I think this will be very mild. All right, then we have our B complex. B vitamins, again, a big topic, so I'm going to keep it really simple. I've listed them here, all the members of the B complex, ranging from B1 all the way through to B12, and then a few others that don't typically have numbers or are referred to with numbers: biotin, choline, and inositol. So these nutrients, although they each have their individual functions, they work together to provide energy. They're very much involved in energy production in the cells. They help metabolize proteins, fats, and carbohydrates to get the most out of our food, and also in the production of red blood cells, which carry oxygen. Okay, particularly B12, B6, folic acid. And they're also involved in a process called methylation, which is a really big topic and difficult to explain in a seminar like this. But I wrote down here just a few of the things that it does. It regulates gene expression, DNA synthesis, multiple cellular functions like detoxification. In fact, that reminds me, I made myself a note to say, to remind myself to say that keeping in mind methylation, one of the best ways to describe what it does is maybe what would happen if you didn't methylate very well. If you've heard of poor methylation or faulty methylation, this is a phenomenon that can occur when inadequate amounts of B vitamins are present in the body. So methylation is performed by the liver, for instance, to break down toxins. When you don't have enough B vitamins, you can't methylate, and it can impair your ability to clear certain toxins like drugs of certain types and chemicals that enter the bloodstream through what you eat, breathe, etc. Okay, so that's important.
Andrea, I'm so sorry to interrupt. I'm just looking at the time and wanting to be respectful of everyone's time this evening. We are at time today, so I just want to do like there are some Q&A questions, some of which I'll pose to you, but maybe to round out your presentation in maybe like a couple of sentences, what would you say is the main point of some of these recommendations, especially related to GLP-1 agonists and the patients taking them?
Well, I think that it's important. I can go right to my concluding slide if that helps. Going back over here, I have right here. To recap, I said that GLP-1 users are at risk of nutritional deficiencies because of the symptoms that prevent them from absorbing or keeping food down. These deficiencies can increase morbidity, various symptoms that can occur from those deficiencies, and diseases as well. So to me, dietary support can help counteract the drugs, but quality supplementation plays an important role in metabolic support that the diet may not fully provide. So I feel that is the role of both diet and supplements in individuals taking these medications for better overall well-being.
I think that's so important, Andrea, and like very thankful that you were able to share your experience and expertise with us this evening, especially on this topic with GLP-1s, which is such a blockbuster drug right now. You know, it is such a focus currently in pharmacy, and we know that's only going to continue to grow. And so making sure that we are really able as pharmacists to create a niche for ourselves in providing the best care to our patients so they don't go through some of those adverse effects of GLP-1s if they're nutritionally deficient, that muscle wasting, bone loss, other side effects like that. I know that Andrea has on the slide here some information about the Pure Lab vitamins and how to order them. If you have any questions about how to order, please reach out to either our team, Shirley or Aisha, or Tanya on the Pure Lab team side, which will share the contacts for later on. I had a comment in here, Andrea, from Dean. Can you comment on how many new studies that recommend vitamin D supplementation far in excess of what is recommended in Canada's food guide? So we see that sometimes in pharmacies too, where patients will come in and say, my doctor is recommending me this many tens of thousands of units. So what do you think about that?
Right. Well, what I think is that it's important to consider that what are the blood levels of that individual, right? What are the optimal blood levels and what are the baseline blood levels of that person? So for various reasons like impaired absorption, again, lack of gallbladder or age, etc., that individual may need more vitamin D than other people. And the only way to know how much to take is to be tested and find out your baseline levels. And you're looking for a number are, higher than what I think what most people are looking to find is just what's on those blood lab results. But we want to get you closer to a number closer to between 80 and 100. I think would be more ideal to prevent some of the health risks that are now being identified when levels are lower than that. So I think that's what it's about. We're big believers in testing and testing often in order to find out what your levels are, and you take the dose that's going to get you into that optimal range.
Yeah, thank you very much. There's a couple of other questions on here about GLP-1s that I'll just comment on from Hossein. So a couple of questions about how about patients under 18 years old with a BMI over 30 asking for GLP-1 agonists. So in the obesity category, there are indications for patients over the age of 12 using GLP-1 agonists. Obviously, it would be patient by patient where you would have that collaborative decision-making with the prescriber and the patient as well. But they can be used for patients under 18. Can we adjust the dose without confirming with the prescriber? So as a part of adaptation, you can adapt a dose without oversight from the prescriber, but of course, within the circle of care, it is important to document and let the prescriber know as well. Is there any limit for duration of therapy with GLP-1 agonists for weight loss? I think there's a lack of long-term data to take a look at limit of duration of therapy for GLP-1 agonists right now. We do know that some patients have taken them for longer periods, for years. Usually it would be until the patient reaches their weight loss management goals, or if they experience plateauing with the GLP-1 agonist, and then ideally they transition from that to regular weight lifestyle, so diet and exercise and other lifestyle therapies for weight management. And then using GLP-1 agonists in special populations. So if somebody is struggling with weight loss in some of these two categories, but their BMI is under 25, so they would be considered normal BMI. So obviously we've seen a lot of news out there of and in social media and popular culture of people using these products when they're not indicated. And obviously it does happen out there, although in these situations it would be off-label. And so not necessarily what the product is indicated for. And so ideally for these patients, bringing in other lifestyle factors and other nutritional supplements, lifestyle changes, diet, exercise to be able to meet their moderate to mild weight loss goals. So I don't know if anybody else has any other questions or in the chat or Q&A. We had, go ahead, Dean.
You know what, Molly? Why don't I just save my comment to the end?
Okay, sure. I was just going to comment that we had a couple of comments in the chat. Ahmed from Nutrigenomics also posted an article about vitamin C deficiency. And as mentioned before, we will be having a separate webinar on nutrigenomics, which we definitely recommend everyone to check out if you're interested in this topic and interested in making it a niche. And, I guess to emphasize before I give Dean the floor, big thank you to Andrea for this presentation on nutritional deficiencies. As we know, to round it all out, there's so many different elements and needs for patients taking GLP-1 agonists. And so there's the nutritional side, which Andrea presented. There's side effect management, which pharmacists are very comfortable with in terms of recommending OTC. But then there's also that ongoing care, and there's an opportunity within this category to really make a difference for your patients, to make a niche within your community. And we hope that we have provided you some options to be able to start doing that in your pharmacies, but also let us know if there's anything else that comes up that we can support you with in this category. So thank you, Andrea. Anything else, Dean?
Yeah, Molly, I just wanted to kind of address, first of all, thank you, Andrea, for the presentation. I just wanted to take a little bit of a different spin, and my apologies, I was a couple minutes late tuning in. So this has already been said, please excuse me, but in case you don't already know, and this is really addressing the pharmacist owners and pharmacists on the call, in Q1 of 2026, semaglutide becomes genericized in Canada. And Canada is one of the few countries in the world which will see that early adoption of a generic product or a biosimilar product of semaglutide. Many of you, I'm sure, have had dozens and dozens of inquiries about the product, whether it be a Ozempic or Wegovy or Mounjaro. You're going to get more. Whereas in the past, the economics for certain patients, for giving them a reason not to take the drug, all of a sudden those will be gone as we sort of look at a generic product. So we're going to continue as a banner to really sort of talk about the GLP-1 class. Tonight was a great start talking about nutrition and the impact on these drugs. But I just wanted to leave everybody with that thought that you haven't heard the last of us on the GLP-1 topic. A lot more to come, and that's all leading to that Q1 2026 genericization of semaglutide in Canada. And so I just wanted to leave that thought, Molly. As you look to your practice, think about how many more times you've had a discussion and a patient has said, "Wow, that's a lot of money." All of a sudden, that'll be a lot less money. So it's going to be a big change, I think, for a lot of your patient base as they sort of hear and talk about sort of generic products related to weight loss. So anyways, Molly, that's all I wanted to say.
Thanks, Dean. And yeah, for sure, there will be such a big shift as we see that happening in such a big category like this with the current indications and the upcoming ones. Raj just mentioned some of the side effects of GLP-1s are still continuing to come out. And yes, it is a relatively newer class of medications, and we'll see it continue, more data continue to be released. Yeah, but we do, I mean, in terms of the efficacy and the value of the medication in some of the current indications, it is making such a big difference. And that's why we really, again, wanted to emphasize how important it is to focus on this category within pharmacy. Yeah, and muscle mass is a huge issue. Exactly. Protein supplement and exercise is a major add-on. Yeah, 100% Raj. And that's why Andrea's focused on some of the micronutrient deficiencies, but definitely big emphasis on protein and really protecting that muscle mass in the patient. Because if you lose muscle mass when you're on Ozempic or any other GLP-1, once you're off of it, that puts you in a worse off situation than previously, right? Because now you're not able to metabolize as quickly. It overall will impact your general health with less muscle mass. So important as pharmacists for us to talk to our patients about it. Okay, so if there are no other questions or comments, we will end off the webinar. And if there's any other questions or comments afterwards, please reach out to us. We will be sharing the slides. We will be sharing the order forms, the details about Pure Lab vitamins, about nutrigenomics, and some of our other program materials. So stay tuned for that, everyone. Great evening.
Thank you. Thank you for having us.
Take care, everyone.
All right.
Good night.
Good night.
What, was I snoring?